Here we are, week 8. Week 8 has a variety of diseases. I'm going to focus on 2 for the purpose of this video. We're going to start off with West Nile virus, and then we're going to go ahead and get into Zika virus. So West Nile virus is a vector-borne disease. It is transmitted by the Culex mosquitoes. There are over 50 different types of mosquitoes, the Culex variety, that can harbor West Nile virus. Okay, so when you're reading through the NIAID website for West Nile virus, as usual, use the questions and the cues that I give you on Blackboard to pursue the information. So first of all, I always like this picture when I use this in class because for some reason for me, whenever I look at this picture, it kind of looks like George W. Bush to me. So not that I want him to get West Nile virus, but I just always see him in that picture, so it always gives me a little bit of a chuckle. So West Nile virus, which is not a chuckling matter, is found in all states of the United States. It's very widespread. It is, again, transmitted by mosquitoes. The majority of people that get infected with West Nile virus exhibit no signs or symptoms. So the immune system clears it out, and there's no problem. But it can lead all the way to, for example, encephalitis. Okay, so I'm not going to go into the specifics that are part of your reading because I want to get into more of a little bit how it's spread so that we can compare that to specifically Zika. So this graphic from the CDC is similar to the graphic in your Deadly Companions book, which is showing the spread of West Nile virus from its entry point in the United States in 1999 in New York. 2000, we can see that it has spread further along the eastern seaboard. By 2001, we've got multiple states now hitting towards the Midwest. 2002, look at all the states, rapidly advancing, right? And by 2003, the majority of the states, the vast majority, had West Nile virus. So the contiguous United States, essentially, by 2005, all of them had West Nile virus. So it spread rapidly through the United States. And if we then ask ourselves why, how could something like this spread so rapidly, right, in just a handful of years from New York all the way across the United States? Well, if we look at these data right here, this is showing, on the y-axis, we've got the number of reported cases, so that is the red lines. The blue bars are the number of deaths that year, and this is starting out at 2001. So if we just follow the red line, we can see that there's an increase. It goes down in 2003, it increased in 2004, it goes down. And so we see that it increases, decreases, and there's a period of months that there's nothing there. So what's the reason for that? Why isn't it just prevalent throughout the entire way? Well, how is this disease, right? The disease would be West Nile fever. The causative agent would be West Nile virus. How is West Nile virus actually spread, right? Well, we should think of the transmission cycle. So mosquitoes, as I mentioned, there's over 50 types of Culex species that can transmit this. Basically, this is the answer right here. So birds, over 200 species of birds, well over 200 species of birds, are known to be able to be infected and carry West Nile virus. So when we go back and we look at the spread of this disease across the United States, well, just imagine those birds flying. Right? So now you're in a state that had no West Nile virus, but these birds come in, they've got it, they had been infected before, and now a mosquito in your location of the Culex variety can feast on the blood of that bird, load itself up, and then when it bites you and is feeding off of your blood, then the West Nile virus can then go into your bloodstream. And so the reason that we have this up and down, up and down, up and down is because mosquitoes are seasonal. So the wet, warm periods when mosquitoes are prevalent, that is when you're going to see the local transmission of West Nile virus through a population. So the combination of mosquitoes, a flying vector, which can land on birds and can land on you and transmit it. Birds can then fly. That's how we can see how this was able to spread across the United States so rapidly, and why we see that it goes up and it goes down, up, down. The up are the wet, warm seasons. So the reason I want to talk about West Nile virus is because it also is a mosquito-borne disease, right? But what kind of mosquito is that? It's the Culex variety, right, which is widespread in all of the United States. Okay, so let's now switch over to Zika virus and talk a little bit about an update. So we've already talked about the transmission cycle. We talked about microcephaly. We talked about a wide variety of things for Zika. So let's go ahead and a little bit of update. So the last time we looked at this table right here, this figure, we were in March, and the number of countries that were affected were less than 60, and now we're at 66 countries. And if we look down below here, what we're seeing is the reporting country versus the number of microcephaly and or CNS malformation causes suggestive of congenital infections or potentially associated with the Zika virus infection. And so we see, of course, Brazil. We know that that's the big one, right? Still is the majority. So we still have the conundrum that the vast majority of the cases of microcephaly have been in Brazil. And so if we look at the United States, right, this is just from a few days ago, April 21st, showing color-coded, and here's the code over here. So the gray is 0, and then the dark green is greater than 7 cases, and then the hash marks are areas with local transmission, right? So again, there's the travel-associated transmission where, I was down in Brazil, I came back to the United States, and then I was diagnosed with Zika virus. So that is travel-associated. And that, as we can see down below, is that all the cases so far in the United States are travel-associated, 388, and then there was some sexually transmitted cases. So we know that it's sexually transmitted as well. Okay, so we're concerned about the pregnant women that have Zika virus due to the microcephaly, and we will find out how those cases turn out. And if we look at the US territories here, what we see is that the locally acquired cases, 500, right? So what we're talking about is Puerto Rico, right, where Damon is planning on going with his family this summer, as he mentioned on a discussion board. And then the US Virgin Islands, we've got locally transmitted, and American Samoa, we've got locally transmitted cases. But here in the contiguous United States, the states proper, so far we only have the travel associated. So nobody's been spreading it through mosquitoes yet, right? So that's the good news. So if we then kind of put this in a little context, right, the dark green, for example, Texas, Georgia, Florida, they are the ones with the higher number. And that is where all of us live, right? So Andrea's over here in California, where there were 29 cases, which is 7% of the total United States. Dee Dee's up in Illinois, right, where there have been 12 cases. Christine's in Pennsylvania, 15 cases. We've got Candace in New York City, or New York, with 60 cases. So that is the almost the largest, so that's 15%. Then we've got Ann in Maryland with 8 cases, Janet's in Virginia, 10 cases, Maria in North Carolina with 10 cases, Kathleen's in Georgia, 13 cases, and then the rest of us in the class, 84 cases in Florida, right? So we have a lot of travel from Latin America into Florida, and so and that's 22% of the cases in the United States. And so that's how we fit in terms of the states that we all live in this course right now. And let's think about, okay, so we've got no locally transmitted cases yet. So what will it take to have locally transmitted cases in the United States? So what we need for localized transmission in the United States is the proper vector. Of course, that is Aedes aegypti. Okay, that's the main vector that we've been discussing. And if you look at the estimated range from the CDC, all of the areas in blue are potentially areas that Aedes aegypti can exist in. So it also is seasonal, right? It's a seasonal mosquito. And so the season is coming upon us, the warm, wet season. Right now, there's a lot of concerns in Houston. If you've been following the national news, they've been having a lot of flooding there. It's very warm. And there's a big concern that there is going to be a lot of breeding grounds for Aedes aegypti. And so if people are coming back from Latin America with Zika virus, and there's a lot of mosquitoes around that can be the vector and it feeds off of them, then if that mosquito flies somewhere else and feeds on somebody else, they can then transmit Zika virus. So that is how, essentially, if we get localized transmission in the United States, that's how it's going to happen. Right? So the question is, should we be really concerned about this? Well, some people who know a lot more about this than I do, point out, rightfully so, that we've had some small number of cases of dengue fever in Florida and in Texas, a couple other places, but they've never become sustained localized transmission. And so why is it important that we then kind of look at dengue virus to think about how Zika virus might affect us for local transmission? It's because it's the same mosquito that transmits it, So if we look at chikungunya, dengue, yellow fever, and Zika, kind of think of them all the same way, not to say that they're all transmitted exactly the way, and there are different levels of why one can be transmitted more locally than others, but there's so much unknown about Zika virus right now that we just don't know, and that's the best question. So some people are really raising the alarms, like, look, if we start getting Zika virus and it is locally transmitted, look at this huge range that can be people that can be affected, right? And so that's true, but if we look at dengue, maybe it's not as much of a problem. But the big thing is, we do not know, okay? And so in the absence of certainty, what are we left to do, right? So I believe the White House requested over $1 billion budget for Zika research and Zika virus preparation. It was not approved through Congress, and so money is being diverted from other infectious disease agents. A lot of money is coming from work on Ebola, right? So now, why do we care about Ebola? That's old news, right? Let's just use that money for Zika virus. Who cares about Ebola? Well, a lot of people are going to freak out if Ebola comes back, right? And in terms of spreading, this is the type of transmission that is pretty difficult to control, right? Now, we can spray for mosquitoes, we can wear nets and all that. So from that respect, we can control it to some degree. And so anyway, Aedes aegypti is the one that's mainly talked about, but also Aedes albopictus it's believed it can transmit it as well. And so if you then look at the range between these two mosquitoes, it broadens even more, and that constitutes more than 60% of the United States population. And so these are just some of the thoughts that we should have in mind. So back to microcephaly, which we talked about before, as was posted on the discussion board. The CDC has now officially declared that they have determined there to be a link between Zika virus infection in pregnant women and microcephaly. This report right here, we've got the link up here in the PowerPoint file. Zika virus and birth defects, reviewing the evidence for causality. And so I'm not going to read this, but basically what they did is they looked at a lot of data. They looked at a number of studies now that are complete, and they used two different sets of criteria. Of course, they overlap, but what they did is they essentially used Shepard's criteria for proof of teratogenicity, and so in that case, for birth defects, right? So microcephaly is a birth defect, and so this is the scheme that was used. There are a variety of criteria, and then the evidence in this case from published studies as well as just well-documented information, and then was the criteria met? And what you can see is that most of the criteria have been met, right? One of them is, in experimental models, so there's no results from animal models in Zika virus and microcephaly, so there's no evidence. So it's not that we have a lot of animal models and it just shows none, right? We just don't have that. And then there's another set of criteria. In this case, it's the Bradford-Hill criteria, and this is for evidence for causation. And so again, there's a variety of criteria. There's the evidence, which you can get into, and then was the criteria met? And you see that the predominance of evidence says yes. And so what the authors say then is that on the basis of the review of the available evidence, using both criteria, right? As frameworks, we suggest that sufficient evidence is accumulated to infer a causal relationship, meaning a cause and effect, right? Between prenatal Zika virus infection and microcephaly and other severe brain anomalies. And so, read more on this. I'm not going to hold you accountable for all of the specifics, but when you go through all of this, it is quite convincing. And so, in terms of microcephaly, and pregnant women, going back to the United States in terms of the number of pregnant women here, right, 33, the question is, will we see an increase in that? And so hopefully we do not have a localized transmission, but I'm sure all of you will be keeping a keen eye out in the news. I'm sure you will be paying attention to your local health or state health departments to see what the information comes out. Some of you have mentioned that you've had patients and other people asking you a lot of questions. Hopefully this information clarifies a little bit more. And I'll also have a discussion board post where if you want to ask any specific questions or weigh in it on Zika virus specifically, that would be a good place to do it, so that by the end of this course, everybody feels as though they know what we have evidence for, we know what is speculation, and kind of thinking about what we might want to think about in the future. So that said, that's what I have for Zika virus.